afternoon. Good afternoon. Welcome to another lovely week with all of you. Yeah, hope you missed us for the past 2 days. We also did miss you. But of course, things have to always be there, right? Right. So, what are the things that you're all up to? How are your studies going? What are you up to? We are really looking forward for the Independence Day tomorrow. Yes. Good, good, good. So all are doing well? Yes. I hope all are excited to have another week as we are, because we would definitely love to come in front of all of you. Okay, Neetu Maria Matthew, good afternoon. Jinsi George, good afternoon. Maya Suresh, good afternoon. So a very good morning, good afternoon, and a good evening to all my lovely students. Asha Sebin, good afternoon. Atira Prashant, good afternoon. Christina Susan, good afternoon. Neetu Thomas, good afternoon. Lita Rishi Rahul, good afternoon. Dija Joby, good afternoon. Excellent. So just to welcome all the new students. Sibi Thomas, Israel, no? Yeah, I remember. Nilda Dominic, good afternoon. So very, very, very good afternoon. Because as I've just mentioned, there are students from different parts of the world. So it's an honor to be in front of you on behalf of Neetu's family. Your presence is an honor for each one of us. Couldn't ask for more. Vinita Vinu, good afternoon. Daphne George, good afternoon. Namita Shaji, good afternoon. So we have people from, of course, all part of India, different parts of Middle East, Israel, different parts of Africa, Australia, New Zealand, Ireland. We have people from UK, Maldives, Malta, Sri Lanka, Nepal, Indonesia, Malaysia, Thailand, no, not Thailand, Afghanistan, Pakistan, Singapore. So couldn't ask for more, isn't it? Shanti Reddy, good afternoon. Tintu Manu, good afternoon. Namita Shaji, how are you? How am I? I'm doing excellent. Namita, thank you very much for asking. How about you? Anu Nikki, good afternoon. Chinju Sunny, good afternoon. Manju Mary Matthew, good afternoon. So is there anybody who's attending for the very first time? ആരെങ്കിലും ഉണ്ടോ? ആദ്യമായിട്ട് ലൈവ് അറ്റൻഡ് ചെയ്യുന്ന ആരെങ്കിലും? സ്മിത ലിബിൻ, good afternoon. രശ്മി ലിബിൻ, good afternoon. ആരെങ്കിലും ഉണ്ടോ ആദ്യമായിട്ട് അറ്റൻഡ് ചെയ്യുന്ന ആരെങ്കിലും? I want, see, that is the most important thing, is about your support on the aspect of validating, like your presence, your answers, your clarification of doubts, everything is always accepted. So the only way that I would know that you're all there, you're okay with whatever that we have told you, you don't have any doubts, is the way that you respond. Sivi Prince, good afternoon. Benny Sebastian, good afternoon. Amrita Janish, good afternoon. So if you are new, we have just pinned the official Neetu's Academy Telegram page, because that we have only 2 Telegram page. Again and again, I'm reminding you, we do not have any other group. One which we have just pinned, that's the official Neetu's Academy Telegram page, and the other one is the exclusive reading Telegram page. We only have those 2. Now, why those 2? That's all for your benefit. The one which you have just pinned, that's where all the general information will come in front of you. Madhusmita Behra, good afternoon. Jomin John, Jomini John, good afternoon. Sandhya Giresh, good afternoon. Razia Sajid, good afternoon. Soni Bobby, good afternoon. Christina Sabu, good afternoon. Sumini May, good afternoon. So very, very, very good afternoon to all of you. So I haven't seen anybody telling that you have attended for the attending for the very first time. So hope all of you were there before. Okay. Still, okay, there might be students who are still reluctant to come take that first step. Appreciating yourself in front of crowd. You have to, because that urge inside you should come. Okay, I'm here with a purpose and I'm going to meet that purpose. Right. So still nobody have told me. Alfina Shafan, good afternoon. Asha Arnair, good afternoon. Sajita Shahu, hi. So yes, few new names, okay, which I have not read before, but still nobody have told me that you're new. അങ്ങനെ ആരെങ്കിലും ഉണ്ടോ who's here for the very first time? അതെന്തിനാ ചോദിക്കുന്നതെന്നറിയോ? See, our students in front of us are doing a lot of things to support us because they are sharing the very same link, they're supporting us by liking the page, following the page, subscribing to our channel, and even commenting. See, those comment and all are very, very, very important. So Shiona Anthony, good afternoon. So because of them we are here in front of you, because whatever we are is because of all of you, because the valid comments that you have shown to like you have told us, the support that you have rendered to us. So we always feel that you are our patrons. Good. So as you can see, we have an array of linguistic exams that we give training on. So if you want to know any insights about it, please do not hesitate to call the number which is there on the screen. They will be happy to assist you. Okay. Vidya Vijayan, after a long time. Good afternoon. Akshaya Tangachan, after a long time. Good afternoon. So few known names for me. Right. So it's a mix of known, familiar, and unknown names. So that's the beauty when you come in such a live session. Sonia S. Sanil, good afternoon. And also I love to see a lot of number one icon are there now. So that shows that how much you are supporting us. So thank you very much. So if you have not yet liked our page, if you have not yet subscribed to our channel, if you have not yet followed our channel, the page that you're watching, please do, so that you will not miss any thing that we are going to come and bring it for you. Okay. Now we have regular batches as well as crash courses, and as you can see, our next regular batch is only from October, November and December. Till that time we are full, and that's all because of the trust that our students have in us. They're all ready to wait, they're all ready to take that first step to reach that dream country of yours. Sabina Chinju, good afternoon. Aringlondo, attending for the first time? Anybody want to tell me that I'm attending for the first time? Aringlondo, okay. Rosmi Jomi, good afternoon. Excellent. Jyoti Janu, good afternoon. Excellent. So, because there is nobody, all of you are aware of what we are doing, so I'm not going to waste your valuable time. So, are you all ready for today's session? Can you tell me, yes, I am? How many of you say that I will get all the answers right? I will in the comment. Jinsi Soju, good afternoon. Comment. I want all of you to comment. Do not refrain. With a small step, you might feel that what is the purpose, but that has a great impact in your life because you are taking your own step. The journey of 1,000 miles starts with a single step. That single step is this. C.B. Thomas, the person from Israel, was the first to say, yes, I am. Neetu Thomas, yes, I am. Atira Prashant, yes, I am. Good, good, good. CB, I will. Very good. That I will is the most important thing. Amita Shahji is ready. Excellent, excellent, excellent. Maya Suresh, I will. Very good. Daphne, I am. Okay, excellent. Ilya, good afternoon. Asha Sebin, I will get. Very good. That should be. Suminimi, I will. Excellent. This is the power that you're going to show. Jinsi George, I am. Okay. Razia, I will. Excellent. Namita Shaji, I will. Okay. Good enough, good enough. Vidya Vijayan, I will. Nilda Dominic, I will get. Excellent. That shows that strength of yours, isn't it? I will. Sabina Chinju, I will. Shiona and Anthony, I will try. No, I will try. I will. I will try is a possibility. I know that you will. So I want you to start saying I will. Amrita, I am. Atira, I will. Asha Sebin, I will. Jyoti Janu, I will. Very good, Madhusmita Bera. Yes. Good, good, good. So because you all said that you're all there, I like those responses. See, the more you respond, the more, what can you say? And we will also be a bit more enthusiastic on the aspect of reading all those lovely names that is going to go along with that. Jinsi Soju, I will. Neetu Thomas, I will. Excellent. So since you all said that you're ready, what are the things that we do? First, we will do a part B. The question will be coming on the screen, and as soon as the question comes, do not waste your valuable time. Just do as quickly as possible. Do find an answer. Then we will discuss. Okay, because our job is to make sure that you're all there on the aspect of finding the right answers. We will look into Jinsi George. I will. Excellent. There you have the question. So please do it and then we will discuss. Do not type your answers. I will tell you when to type the answers. Right, there. Your time has just gone, isn't it? So all of you have got an answer? Yes. How many of you have got an answer? Tell me. Yes, I have done. Sumi has said done. Madhusmita done. Neetu Thomas done. Okay, good enough. Atira Prashant done. Razia Sajid done. Okay, fair enough, fair enough. At least see that response is also more. That means most of you have done on or before time, which is an absolute stunner. Maya done, Vidya done. Excellent. Nilda Dominic done. Jinsi Sojuru. Yes, okay, fair enough. Jobita Thomas done. Sibi Thomas done. Daphne done. Okay, fair enough. Manju Mary Matthew done. Okay, excellent. Cincy George done. So there were Ailia done. Okay, there were a few who have said good afternoon in between when the student was doing. So a very good afternoon to all the lovely students. If I missed your name, it's not deliberate because I didn't want the students to be disturbed. So that is the reason I was not able to read out your name. Sabina Chinju, yes, done. Christina done. Jyoti Janu done. Namita done. Amrita done. Asha done. Okay, excellent. So most of you have responded. Sneha done. Excellent. So because you have all done, let's go and see what is your answer and how we came into that answer. Okay, Dolly Anthony, good afternoon. Anaganus, good afternoon. Right. So as the question comes up on the screen, before that, just to discuss on the aspect, there you have the question. See, what is the fundamental thing that you have to always remember when you're doing part B? See, part B and C, it's about finding the answers, and of course, A is also there. I'm not saying no, but it's about how you relate it to the question. Okay, so reading the question and understanding the question is very, very, very important, as well as underlining the keywords of the question. See, students still doesn't feel the importance of keyword. So you're expected to find an answer with regards to that keyword. Of course, you have to read the paragraph. I'm not saying no. But what are the fundamental things that you do? Read the question, understand the question. As you are reading the question, underline the keywords of the question. Very, very, very important. Okay, in between, yes, of course, you have started telling me Sumi, B, Razia, A from first two lines, Madhusmita, C from last two lines, Sumi also B from last lines. Okay, Neetu Thomas, A from first two sentences, Sandhya, A, Rosmi, C, Shiona, B, Sibi, a verbal, what is it? A verbal means speak, okay. Maya A, Nilda keyword C, Sneha A, Ailya C, Daphne, Jyoti Janu A. I want all of you to tell me what are your answer, and the most important thing, not just what is your answer, where you got that answer from. That where is important for me. Manju C, Jobita A from first few sentences, Atira C from last part. Okay, fair enough. Gigi Jacob C. Okay. So A, B, C, all those three answers came without even, that's the spirit, isn't it? Whether it is whichever is right, you have to validate. Okay, see, I got this. Fair enough. Alfina C, Jinsi George C from first two lines. Okay, see, now this is the diversity, isn't it? A from first two lines, C from first two lines, B from last two lines, C from last two lines. So all are possible. Chesley Nidansi, new name. B. Benny Sebastian Dunn, Christina Sabo C, Asha Seben C from last line. Okay. Manju Mary, last sentence or C, G Mulrenny C. Okay, fair enough, fair enough. Now let's go and see how to do with part C. Sorry, part B. See, now the question is clearly saying the guidelines say that before, now this before is very important, going on a short break. So now before short break, nurse must. So they are very specifically asking you before taking a short break, what should the nurse do before? Okay. Now, let's see, there are, after reading the question, underlining the keywords in the question, then you have two options. You can read the answer option like me and underline the keywords answer option, then go and pick it up from the paragraph, or you can read the paragraph and then pick it up from the sentence. Now, what are the answer options? Speak to the colleague who will take over. So, who will take over care of patient. So, speak, take over is enough. Okay. Next, keep a written record who has agreed to look after. So, written record who agreed to look after patient. Yeah, I understand it. Ensure that patient's documentation is up to date. So, documentation up to date. System if you want. Yeah, fair enough. Go on. Now, after this, extract from staff guidelines, short break, long break. So you have always given a hint saying that this is referring to both short breaks as well as long break would be there. So be aware of it. A short break handover occurs between the nurse responsible for the patient and the nurse who is assuming responsibility of the patient. So the nurses must. Now this is where this comprises of, which comprises the short break handover. So this is referring to the short break handover comprises of a short verbal handover focusing on the greatest risk for the patient and is essential to uphold patient safety during this short break. So a short verbal. So speak to colleague who will take care of. So for me, short break is there and the verbal is also there. So who will take over the patient also there. So slightly pointing into A. I'm not confirming it yet. Reading further, a long break handover. Now is it to our question? No, it is not to our question. Also occurs between nurses responsible for the patient and nurses who is assuming responsibility of the patient. So ensure that patient documentation is updated. That is nothing there. Keep a written record of whoever written. This, however, comprises, which comprises the long break handover comprises of verbal handover in ISBAR format, that is ISR, identification of patient, current situation, any risk recommendations for break intervals. Furthermore, not only this, in addition to it, documentation of handover. Documentation of handover is for what? Is it for short term or is it for long break? This is for long break, not to a question. So B is eliminated, and transfer of professional care needs to be recorded in electrical. So documentation is also needed for long term. Our question is short term. Understood why A is the right answer? Because your question is for short term, not for long term. Clear? Any doubts? Anything that you want me to clarify? Anything that you are doubtful about? Neetu Thomas, thank you for that. Any doubts? Understood. Namita Shahji, dancing, of course. I love people who make the most out of their achievement. Keep on dancing. Maya Suresh, understood. Any doubts? Anything like Atira is clear, okay, fair enough. Manju Mary, yes sir, now clear, fair enough. Vidya Vijay, sweating, do not worry, we are here to guide you through, isn't it? That's why, see, we always look into keywords. Keywords are not going to be the answer. We always have to understand the gist of what you're reading. Manju Marita, I'm a bit late. I know you're busy in Saudi, so no problem at all. As long as you're all there, couldn't ask for more. Nilda clear, Madhusmita clear, Sumi Baiju clear. Jinsi Soju, yes, it's clear. Anumol Suraj, okay, clear. Asha, clear. Gigi Jacob, one more time explain. See, the question is short term, not long term. The second part of the paragraph, that means I'm just going to erase all those scribblings so that you will understand. See, the first part of the part is only talking about short term till it ends. Now this part onwards till down, it is asking about long term. Your question is short term. Understand? Identification of patient and documenting long term. If you enter it onto the system is for long term, not for short term. Elimination is the most sweetest way to find the answer. Okay, recording a patient long term. Patient documentation is up to, see, ensure that patient documentation is up to date. That is not mentioned at all. See, furthermore, documentation of handover and transfer of personal care needed to be recorded in the, yeah, they are saying it has to be recorded, but up to date on the system, ensure and all, it's not really there. But even if it is there, that is for what? That is for during the long term, not for short term. Understood? Excellent. I hope it is clear now. So answer to the question is what you are expected, not just picking something from the paragraph. Am I clear? Right. Now, let's see what is today's part A. So what is today's part A? Today's part A material is what? Digi Jacob, thank you. I hope all of you are clear. CB Thomas is clear. What is today's part A? And most important thing again, I want you to comment on is about how you felt about today's part A. That how is very, very, very important, because with your how only, Neetu Madam will design the next day's material, so that how is quite important for us. Right? So can you all tell me what is today's part A material that has been shared? The Moid cyst. Okay, fair enough. Maya is also saying them. Maya Suresh is saying easy. Okay, am I happy to hear that? Demoid cyst is easy. How about others? I want all of you to comment. Do not refrain. See, don't think elsewhere. Okay, what are others going? Madhusmita is saying easy. Merlin is saying easy. Okay, excellent. So generally, Manju Merita is saying Demoid cyst. But how you felt? Easy material, Namita. Okay, excellent. So basically, it's quite easy because few days it was a bit easy, tricky, easy, tricky, tough. Fair enough. Daphne is also saying easy. Okay. Tina told you easy. Okay. Fair enough. Fair enough. Rosmi is saying easy. Manju Merita is saying easy. Okay, excellent. Moby is saying dermoid cyst. Manju Mary Matthew is saying dermoid cyst. Neetu Thomas is saying easy. Good enough. Dolly Anthony is saying dermoid cyst. Jincy George is saying easy. Razia is saying easy. Jobita is saying easy. Okay, excellent. Amrita Janice is saying the material name. Okay, fair enough. I want all of you to tell me how you felt about it as well. Right, because you have said basically I got a gauge saying that it is easy. So Neetu madam will definitely look into it before she makes the next material. So you'll have the material on the screen. So strategy, what are the things that you have to follow? See, please understand, part A is the first module that you will get. That means out of the reading module, the first one you get. Okay, they'll give you only 15 minutes, 20 questions. So please always be cautious about this time. 15 minutes, 20 questions. Okay, you have to be very much aware of it. 15 minutes, 20 questions. So one question, 45 seconds. Your strategy to do in part A is called skimming and scanning. Skimming is called quick look. Scanning is called detail look. Okay, now how much time can you take to do skimming? The maximum time that you can take is 1 to 2 minutes. That means 15 seconds per text is an average that you can take. Okay, so always look into those kind of things. Right? So after this, you have to always remember they will only present you the material, and once they place it, do not touch the material, do not speak through, do not even see what is out of curiosity and all. They will not publish your results. So don't do anything unethical. Even if on the day of exam when they place it, do not touch the pencil. Let them tell you when to start. As soon as they tell you, do start. And when they tell you, keep the pen down or pencil down, keep it down. When they find that you are again writing, they will not publish your result. Why do you want to do that? Okay, be cautious about. So whenever you're practicing, always keep it more, less on the aspect. So you have to go and say, okay, they are giving me 15 minutes. I'm going to try to do it in 14 minutes. Push yourself to the extreme. Don't be on a complacent note. Yeah. So what are the things that you have to look for when you are doing or skimming through? Skimming means a quick look. As I've mentioned, do not read word by word and all. Okay, English is not a language where you understand by word reading. You have to chunk it. So what are they saying? I'm just going to underline, show you how you're going to underline. Dermoids is sac-like growth in the present of birth. It contains structures such as hair, fluid, teeth, skin. It can be found on the skin. Dermoids occur in the skin layer. That should when this happen during the early stages of development of the uterus system based on dermoids start and experience as their cyst grows and they're important. For example, periorbital dermoid lump near the edge of the eyebrows, swollen yellow tint, ovarian dermoid cyst, pain on pelvic area, time of menstruation, spinal dermoid cyst. Dermoid cyst may compress spinal cord, nerves, causing, these are the causes of it also. So generally, what do I understand? See, they are telling about what these dermoid cysts are, what are the types of cysts that can based on the symptoms, and what are the causes. So after this, I'm going to just give you a bit of an easy way. So diagnosis. So any diagnosis will be based on text B. Why? Physical exam, CT, pelvic ultrasound, all those things. I'm not going to see in this. They're going to give you a study. So text C is about study and text D is about what doctors do, different surgeries. So anything about surgeries where you should go to text D. This is how you get a gauge out of it and then go to question. So when you go to question also, there are 3 types of question which you have to be aware of. And these type of question and the instruction should be by hearted. Okay. So 1 to 7 type of question is called match the following question, where you are expected to write an answer either A, B, C or D. So here you don't have to really worry about, even with, if your skimming is proper, you can easily find the answer. See, for example, size of neck mass that has to be considered as malignant. So where are they talking about size, neck mass? Not in A, not in B. Most probably might be in C. Now where are they talking about? In C. C, suspicious of malignancy, initial size greater than 3 mm, immobilized, not associated. So where are the size of the neck mask? So it is there in C. So my answer to the question number 1 is C. Where can we find utilization of sound waves determining cyst? So where are they going to talk about sound waves that determine cyst? So yeah, sound waves are used where? Sound waves are used only in, so what are they saying? Painless sound waves. So that is as such of a keyword. So that is enough. So what I'm going to write? I'm going to write B. Instance where candidate experience pain in pelvic area. So that should be there in A, because I have read somewhere saying that, okay, they experience pain and all. So you may experience pain, pelvic area. So the answer is A. Now next one. How can we identify presence of delicate areas? So delicate area, I know it is somewhere in B again. Why delicate area? The delicate area is paraphrased as because it is there in sensitive area. So the answer is B. What all particles can be used in dermoid cyst? So what are the things that is included? So the included things in dermoid, I know that it is hair, fluid and all those things. So the answer is A. Now pertinent technique. So technique, do you really need to have an option? Where are they talking about all these technique? They are only talking about in different surgeries where? D. Purpose behind administration of surgical drainage. So where are they going to talk about surgical drainage? Why have they incorporated surgical drainage and all? So if you suspect it and all, so consultation for surgical drainage. So all those things are why? Because abscess seen on imaging. So the answer is C. So I have wrapped up 1 to 7. Please be kind enough to tell me what are your total scores out of 7. In the meantime, the next type of question, 8 to 14, are called short answer question, where the instruction says your answer can be a word, a short phrase, numbers, or a combination of both. You should always remember this, by heart this. So kind of discoloration seen in eyebrow or affected with periorbital. So periorbital, do you really need a second option? No, yeah, I know it is there. So color. So color is yellow. So my answer is yellow. Easy, right? So most appropriate method, greater size. So method greater size, I know it should be there in D. Now where are they talking about? Large size. So skin which is dark, okay, particularly large. So which one are you going to go do? Oophorectomy. Oophorectomy is the answer. Excellent. Question number 10. Assessment procedure, blunt-ended equipment is used against the skin. So blunt-ended equipment, all those things. So equipment are all mentioned where? It is there in. So what is that? A painless how to see image during pelvic, provide a probe against your drug or transfusion, you provide a use a wand into the vagina. So the answer is pelvic ultrasound. During your applies a probe against. So what is that equipment? Probe against the skin. So the answer is B. So pelvic ultrasound, and you get that also from, where do you get that? It's a very straight answer, isn't it? Okay, so during pelvic ultrasound. Question 11. Initial drug given to children for managing neck mass. So initial drug, neck mass. Where are they talking about initial management? So it should be there where? Somewhere in that neck mass is there in C only, So what is the initial trial of? Oral antibiotics. So initial one is oral antibiotics is a two-word answer. ORALANTIBIOTICS is the answer. Question 12. Which is the sensitive area painless test taken out images of cysts? So where are they going to talk about painless area, images about cysts? So painless area and all again in B somewhere. So this test shows the cyst in a sensitive area. We know that because we have already referred to. So where is the area? Carotid artery. So what is that? Carotid artery is the answer. Type of dermoids, squashed nerves, fatality in arms and legs. So fatality means difficulty. So arms and legs and all, difficult and all, where are they talking about? They're spoken about in difficulty walking, urinary contention, weakness in arms and legs, so compress of cords and thing. So everything is there. So the answer is spinal, spinal. So squash means compress the nerves and make fatality, weakness. That is where that fatality is. Okay, good enough. Total number of days taken by children to finish the course of medication. So this should be there in C, isn't it? Total number of days. So the total number of days are mentioned where? It is mentioned as, what is the total number of days? 10. 10 is the answer. So the final stint of question, these are called fill in the blanks question, where the instruction is as similar to short answer question, but here redundancy, article redundancy are also considered to be very, very, very pivotal. So be aware of it. So question 15. When the cyst is on the skin surface, your provider can easily examine cyst on the area around it through a dash. So very specifically saying how can you assess when. So what are they saying? If the cyst is close to the skin, your provider can examine the sins of area exam. So when using through a physical exam, PHYSICALEXAM exam. So if chronicity of the asymptomatic mass endures weeks, the patient should be referred to surgeon. So how many weeks prior? So asymptomatic chronicity, so it should be there somewhere. Consider referral to head or nurse neck surgeon if the mass enlarges during observation. Asymptomatic mass larger than 2 centimeter persists. So our next keyword is weeks. So what is that? 4 to 6 is the answer, because weeks is already mentioned in the question. So 4 to 6. 17. Specialist conduct and after an it should be a vowel sounded singular one to remove cyst from the ovary or both. So they are saying ovary or both. So where are they talking about all these ovary and all those things? So it is as such mentioned, it should be there in D, no? So both is the problem. So what is both? The answer is ovarian cystectomy, remove cyst, one or both ovaries. So the answer is ovarian cystectomy. Both should be there. Question 18. Dash differ based on type of dermoid cyst and growth of for the people's experience. So what are the things that they have saying? So what is there depending on? So symptoms are varied dermosis and people experience symptoms as this is grows. So what is that? Symptoms, SYMPTOMS. Jobita larger than 4 to 6 is not right. 4 to 6 weeks, because weeks is what is being asked in the question. So 4 to 6 should be the answer. Penultimate question, question number 19. If ultrasonography displays no, children should be considered to intravenous antibiotic consultation of ENT. So this should be there again in C, isn't it? Children and all those things, ENT and all are mentioned where? So consider ear, nose, throat specialist. So this is the ENT. So what are the problem? Abscess. ABSCESS is the answer. Very good. So the ultimate question for today. During fetal development, dash don't grow concurrently and leads to dermoid cyst. So what is the thing that doesn't grow? So it should be there in text here, isn't it? Dermoid cyst occurs when skin layers doesn't grow. So the answer is skin layers, SKINLAYERS. So I have wrapped my 20 answers. If there is any doubt, please be kind enough to clarify it. Or if you have no doubts, please be kind enough to tell me What are your total scores? Excellent. I could see that most of you have written all the right answers. So I always expect all of you to say what? 20 out of 20. 19, Susan, excellent, good enough. Keep it up. Good, good, good. How about others? Tina Tojo, 19. Good enough, excellent. Merlin Sebastian, 19. Excellent. Keep it up, keep it up. Jobita Thomas, 19. Excellent. Keep it up. Madhusmita Bera, the first one to say 20 out of 20. Excellent. Jinsi George, 19. Very, very good. Keep it up. See, do not worry about what others are getting. Okay, I want you to. Namita Shaji, the second person to say 20 out of 20. Maya Suresh, 20 out of 20. Excellent. Very, very good. Keep it up. Whatever you get, be happy with that. Sanju Matthew, 19. Gigi Nidin, 18. Okay, excellent. Good enough. Vidya Vijayan, 19. Good enough, good enough. Neetu Thomas, 18. Excellent. I want all of you to come and see. Do not worry what others are getting. Daphne, 17. Excellent. Good enough. See, because it's the first day, just keep it as a base. And this is where I stand for this week. I'm going to improve, do practice. If you are, see, even if you get 1 mark more, even if you make one minute less, that's all growth. It's a part and parcel of growth, isn't it? Manju Mary, 17, excellent, good enough. Good, good, good. Okay, I think not all of you have reported in the sense you have not told me. Sharanya is Nair, 18. Okay, excellent, good enough. See, I always love those people who have that courage to tell me the answers. Why? That needs the courage, isn't it? I've got this. Right. So as you have said, Rosmi Me 18. Good enough, good enough. So we've come to the final stage on the aspect of today's session. Alfina, 17. Good enough. So just to give you a quick reminder, tomorrow is Independence Day. So a very happy Independence Day to all of you, and as a proud, like